about to listen to the Dr. Dahlia Show. Sassy, stimulating medical talk radio. Any medical advice Dr. Dahlia Wax gives on her show should not be substituted for an actual visit to your medical provider. And now, here's Dr. Dahlia.
We're back on the Dr. Dahlia Show, 1-877-DOC-DALI, 1-877-DOC-DALI. So good night, sleep tight, and do not let the bed bugs bite. But bed bugs are biting. I'm seeing a lot of patients have bed bugs and bed bug bites. Why? Well, because they're traveling. And every year we get the Orkin top bed bug city. And if LA wants to host the Olympics, they're going to have to get their act together because they made number 2 on the list. Number 1 for bed bugs, Chicago. Again. You know, it's interesting. When my parents would say, good night, sleep tight, don't let the bed bugs bite, I really wasn't, I'm not sure how do I fend off a bed bug assault. As an adult, I don't think we're anywhere equipped. Home, hotels, even places of work get infested by bed bugs. And here we are again, Chicago, on the top 50 bed bug cities list, has ranked worst in the nation now multiple times in a row. So I'll give you the numbers, but first, what is a bed bug? So a bed bug is the Cymex lectularius. Yeah, I pronounced that correctly. That's the genus species, Cymex lectularius. They're insects that grow no larger than an apple seed. Their lifespan on average is about 4 to 6 months. Some, however, can be dormant for over a year. Females may lay anywhere from 250 to 500 eggs in her lifetime. And sometimes they could lay about 1 to 5 eggs a day. The eggs hatch between days 6 to 10. The little baby nymphs are hungry, and they are ready to eat when they're born. They will become adult bed bugs in approximately 7 weeks. Now, what do bed bugs prefer to eat? Your cereal? Nope. Your peanut butter jelly sandwich crust? Nope. They want blood. They prefer nice, warm blood meals, and they'll take a good 5 to 10 minutes to feed. As they feed, they may change shape and turn from a brownish color to a red. You will not feel the bug bite on you or the bed bug on you feeding. Why? Because of that suck blow mechanism where they blow in a local anesthetic and an anticoagulant, so you don't feel it while that bug is trying to get your blood, and the anticoagulant allows the blood to come in to come a little easier. So it isn't clotting while the bed bug is trying to eat. Once the bed bug leaves your skin, your immune system wants to now address what that bed bug did. Now you're going to start to feel it. And so you might get inflammation, you may get itching because the body is trying to address the microscopic dirt and whatever got in you. Bed bugs can hide anywhere. Hotels, cruise ships, dorms, apartments, homes. They really like to be on your mattress, your box springs, your bed frames, torn wallpaper, carpet, furniture, rugs, flooring, corners, cracks, crevices, picture frames. And so it's hard to see them because they're really, really tiny, but bed bugs will molt. And so they may leave their exoskeletons and sometimes their poop, their excrement. So you might be able to pick up on that. So which cities are in the top 50 bed bug city list? Well, Chicago made number 1. Then came Los Angeles, Detroit, Cleveland, Indianapolis, Springfield, Illinois, Washington, D.C., Columbus, Ohio, Pittsburgh, and Grand Rapids, Michigan, the top 10. Then comes Denver, New York, Milwaukee, Baltimore, Cincinnati, Raleigh, North Carolina, St. Louis, Charleston, West Virginia, Davenport, and Iowa. Then comes Flint, Michigan, Atlanta, Philadelphia, Dallas, Oklahoma City, and Cedar Rapids, Iowa. Then Hartford, Connecticut, Charlotte, North Carolina, Peoria, Illinois, South Bend, Indiana, and number 30 was Seattle. Rounding out the last 20 is Richmond, Virginia, Youngstown, Ohio, Greenville, South Carolina, Nashville, Buffalo, Omaha, San Francisco, Dayton, Norfolk, Virginia, Knoxville, Tennessee, San Diego, Toledo, Ohio, Las Vegas came in 43, Syracuse, Fort Wayne, Tampa, Miami, Minneapolis, Kansas City, and Myrtle Beach. Myrtle Beach is new to the top 50, and Kansas City is new to the top 50. Congratulations. Even Tampa, Florida is new. All right. So I think a big part of this is also travel trends. I like Tampa. And, Tampa, you get to the Gulf. It's a great, I think a lot more people are coming to Tampa. Kansas City has been getting a lot of, especially with the Chiefs, and their success. So we're starting to see more travel there. Myrtle Beach, of course. But, these bed bugs are pretty wily. They're pretty smart. So you need to be smarter. The bed bug bites aren't dangerous, usually. They're benign. But you could have an allergy. You could get a secondary bacterial infection. That's concerning. So what do you do to prevent or to address it? Well, first, make sure your tetanus is up to date because a bed bug could carry tetanus. So make sure your tetanus vaccine is up to date. Secondly, when you notice the bites, wash them with soap and water. Bed bugs carry dirt and other diseases. Thirdly, consult your medical provider if you have multiple bites, severe itching, pain, or feel sick. And then sometimes your medical provider may give you hydrocortisone cream, antihistamines, anti-inflammatories, but you need to be very diligent. Inspect your home or hotel room for bed bugs. Look under the mattresses, pillows, the sheets, behind the headboard, and around where you'll be sitting or sleeping. Keep all your clothes off the floor. Don't have your suitcases on the ground. Use those little pull-out stands or put them on the countertops or desk. Avoid clutter and tuck sheets tightly under the mattresses. I get really frustrated when I'm in a hotel because the sheets are tucked so damn tight and I have to untuck, but that's why they do it, to prevent the bed bugs. Vacuum around all beds, mattresses, legs of furniture, corners, crevices, rugs, upholstered furniture. Wash your bedding and clothes that you think might be exposed in hot water. And then you might want to have a pest control professional come out. Remember, this came from Orkin. So my guess is Orkin, does this. Consider having a pest control professional come out, take care of the business, do what it's got to do. An assault on bed bugs is what we need to do. 1-877-Doc-Dolly. Don't go away.
Hi, everyone. If you've been injured in an accident and think you deserve compensation, listen up. Because we have legal professionals standing by right now to answer your questions for free. We'll help you find out if you have a case and how much it's potentially worth. If you were hurt in a car accident, truck accident, motorcycle accident, rideshare accident, slip and fall, or any other type of accident, call our 24/7 hotline now and let us help you find out how much your case is potentially worth. Call 800-978-6800. That's 800-978-6800. 800-978-6800. I'm Gina Hart, here with spokesman Jack Mercer. So Jack, tell our listeners who should give us a call right now.
Well, Gina, first off, thank you for having me join you here in the studio. It's always great to answer the listeners' questions. Now, as far as who should call in, anyone who's been injured in an accident and think you deserve compensation, give us a call right now. The call is free, the consultation is free, and with our no-fee guarantee, you pay nothing unless we win you money.
That's great advice. Thanks, Jack. And is it true that the Legal Help Center is open 24/7?
That's right, Gina. We're open anytime you need us, 24 hours a day, 7 days a week. So if you or someone you know were injured in an accident of any kind, call now and let us help you find out if you have a case and how much it's potentially worth. Call 800-978-6800. That's 800-978-6800. 800-978-6800. Advertisement sponsored by Legal Help Center. Not available in California. May not be available in all states.
back on the Dr. Dahlia Show. Thank you all for tuning in. 1-877 Dr. Dahlia, 1-877 DOCDALI. Big thanks to Talk Media Network for making the show happen. Big thanks to Daniel, our producer, and big thanks to y'all for tuning in. We really do appreciate it. Don't forget to follow us on Twitter or X at Dr. Dahlia, Facebook, The Dr. Dahlia Show, and on YouTube, click like and subscribe. So we have some breaking news. The gunman has been arrested at a barricade just north of the U.S. Capitol today. Vehicles had swarmed a Ford Bronco SUV and arrested a man who had a firearm. He was at the north barricade of the U.S. Capitol. Firearms are prohibited on Capitol grounds. They say the north barricade is going to be closed while USCP investigates. Our investigators are working to learn more about the suspect and why he drove to the U.S. Capitol. Now, the vehicle also had a dog. The House and the Senate are both in session today after their July 4th holiday recess. Security concerns, and also it's a day of grieving with the loss of Senator Lindsey Graham. And so I'm wondering if this person allegedly thought that people's guards would be get down, because of what's been going on. The House and Senate have returned. Security concerns for politicians have dramatically increased recently. They say the USCP is recording in January that concerning statements, behaviors, and communications against lawmakers and others connected to Capitol rose by nearly 60% from 2024 to 2025. The Supreme Court is also looking for improved security as well as increased funding. Apparently, Justices Amy Coney Barrett and Elena Kagan are going to be testifying to Congress tomorrow about their needs. Barrett has direct experience with security threats. She was nearly victimized by an attempted swatting scheme in May. Brett Kavanaugh was targeted in a murder plot in 2022. They say last year House members pushed for beefier personal security provisions as Democratic Joe Morrell pushed for each congressperson to be assigned an armed security guard. I was blown away at how little security many of these individuals have. It was interesting because I had invited a congresswoman to come on my show early on when I was in radio. This was probably back in 2009 or 2010. And she drove herself, walked, into the studio by herself. And I'm like, you would think you would have security. But also, even though political violence has always existed, the rhetoric and the anger people have really skyrocketed. And now, people are looking at what our Congress people do as life or death. See, it used to not be like that. Yes, your politicians could screw things up. They could affect your job. They could affect farming. They could affect, your vehicle choice. But very few people really wanted their congressman to die. Now it is so polarized where, any vote against voter ID or vote against Roe v. Wade or vote against, people are taking so seriously. And I'm like, calm the hell down, people. But the politicians are making it life and death. I had a mild, small interest in politics years ago. Not really a lot to go. I'd rather have fans than votes. I don't really want to sit and try to get votes, and I just don't like that. I'd rather entertain, and I'd rather teach. That's what I'd rather do. But when I was offered, I had been asked to run for Congress. I'd been asked to run for mayor. And when I was talking about it, to the family, my kids are like, no, Mom, you could get shot. No, we don't want you to do that. And that was after when Congresswoman Gifford was shot in Tucson. And, my kids weren't wrong about that. And that fear, it has always been there for decades. But now nobody really talks about how much of the threats and the hate. And a big concern that people have and that they aren't aware of is once you leave, where's your security? Now, presidents get Secret Service for life. Political candidates don't. I remember when McCain lost the election to Obama, you saw him driving himself out of one of the Washington parking lots, You don't see you didn't see the Secret Service, you didn't see the security. And it's like, well, that's kind of scary. If you're a political candidate now, whether it's running for primary, whether it's running for state senate, whether it's running for, wow, people take this stuff seriously. We just had some case, I believe, that involved the county commissioner, and it got bloody. Man. And so for those of you thinking about politics, I don't want you scared. You want to represent the country. But you might want to make sure you have plan B. Because things you say or things you do can make you a threat, even if you feel your side is justified and you're right. And, there's crazy people out there. I never wanted to put my kids in private school because I grew up with public school. I thought private school was going to be an absolute waste of money. But I had to because I had stalkers. And I had people, they weren't necessarily threatening, but I had somebody in my home, came into my home in the middle of the night. And I was like, I need to know that my kids are protected. And, we talk about celebrities. One of the reasons why these celebrities go so crazy or go into isolation is because they need security. And that's expensive. And if you were making $30,000 a sitcom in the 80s or 90s, you became a star, somebody started to obsess about you, you might not have the, hundreds of thousands of dollars you need for security. So they need to keep trying to get back in there and try to get back into the public eye and try to get more money and if not, they have to go somewhere and just hide and try to be anonymous because they just don't have that ability. How do these Congress people do it? Those individuals that really hate Obamacare, are they going to be going after the 2009 Congress people? Those people that really can't stand Trump, are they going to be going after individuals who didn't want to impeach him? Politicians have targets on their back, and it's not safe. And I don't know what they do. Like Sarah Palin, you don't really see much about Sarah Palin. Now, luckily, she's in Alaska, so it's a little easier for her to kind of go and hide or whatever. But there were people that threatened her, and you hope the threat dissipates. But there's some real crazy people. Apparently, somebody wanted John Lennon dead as far up into the 80s, and they got him. Now, also adding to some of the drama this weekend. Over the last few days, is there was an illegal immigrant who tried to ram an ICE agent. The ICE agent shoots and kills him. This is being reported by 2 Idaho News and multiple other outlets. The Houston Chronicle says a spokesperson for ICE alleges the man who was killed was identified as Lorenzo Salgado Araujo, and he tried evading arrest during an attempted vehicle stop at 6:50 a.m. The agent, according to the Houston Chronicle, fired his weapon. Now, video footage is, I believe, showing that the agent was getting rammed, and so the Lorenzo Salgado Araujo was a Mexican citizen who, according to Idaho News, was in the U.S. illegally. The media outlet reported that the deadly shooting happened as the agents tried to conduct a traffic stop in Houston's Magnolia Park. From what I understand, it wasn't necessarily them going after him particularly, but Araujo ignored repeated commands and drove his car towards an agent. The agent fired his gun in self-defense. Araujo was taken to the hospital and later died. This is so tragic. I don't want to see anybody die, and I don't want to see anybody getting rammed by a car. None of the agents were luckily seriously hurt during the shooting. But FBI agents are now probing the case. People are threatening ICE. We just talked about Congress people being threatened, ICE agents, for doing their job. Nobody's threatening Japanese ICE agents or Canadian ICE agents who are doing the exact same job, who are, deporting individuals who, have criminal past or who are here illegally. In fact, their deportation rules are even tighter than ours. And, it's, I grew up because my grandfather was a cop, and if a cop tells you to freeze, you freeze. If a cop tells you to stop, you stop. Don't scratch your ass. Don't reach. Don't try to talk yourself. Just freeze, because any movement could be accidentally inferred as a attack, or you pulling a weapon. And nowadays you see people just drive and use the it's sad, because I think we'd see more lives saved if it wasn't this chaotic. 1-877-DOC-LA.
At Hot Shot Secret, we share the science behind common diesel problems and their solutions. For example,
diesel fuel cetane levels.
in many states, the cetane rating in diesel fuel is 42 to 45. Most diesel engines operate more efficiently with a cetane rating of 48 to 50. One treatment of Hot Shot Secret Diesel Extreme will raise your cetane 7 points, increase fuel economy, and improve cold starts. Due to a cleaner burn, there are less hydrocarbons and particulate matter in your exhaust. This reduces the blockage of your diesel particulate filter. Using Diesel Extreme generates 83% less DPF regeneration. The 6-in-1 Diesel Extreme formula also includes the most concentrated detergent on the market, lubricity enhancer, water demulsifier, rust and corrosion inhibitors, and a fuel stabilizer.
Hot Shot Secret Diesel Extreme is available nationwide at truck stops, fine farm and auto stores, and online at hotshotsecret.com. Hot Shot Secret, powered by science.
You're back at the Dr. Dahlia Show, 1-877-DOC-DALI, 1-877-DOC-DALI. Big thanks to Talk Media Network for making the show happen. Big thanks to Daniel, our producer, and big thanks to y'all for tuning in. We really do appreciate it. Don't forget to follow us on Twitter or X at Dr. Dahlia, Facebook, The Dr. Dahlia Show, and on YouTube, click like and subscribe. This Ebola outbreak is getting a little out of control. Already 1,830 cases, 648 people have died. Cases are now also confirmed in neighboring Uganda, even though the original started in the Democratic Republic of Congo. And now we have a second American affected. A U.S. citizen working for a humanitarian organization in Congo has tested positive for the Ebola virus. According to the CDC, the Central African country is continuing to struggle to contain the outbreak. The CDC said it was working with the person's employer, U.S. agencies, the public health authorities, and Congolese partners to prevent further transmission and identify close contacts. We don't have a lot of other details, but the individual was taken to Frankfurt University Hospital on Monday. He arrived at the hospital's isolation unit at about 3 a.m. after he contracted the Bundi-Bugyo variant of the Ebola virus in Congo. Last week, according to NBC News, the African Centers for Disease Control Prevention said the outbreak is the fastest growing Ebola outbreak ever recorded on the continent. Now, it's not the worst one. Remember, the worst one happened in 2014 to 2016, but this one is moving faster than that one did. Cases now being confirmed in neighboring Uganda. So this has the potential to become the worst. In the first week of the outbreak, there was an American doctor working in the Congo tested positive, and he was transferred to Germany for treatment. Trump officials said that United States was planning to send Americans who are exposed to a new facility in Kenya. But then the project was suspended after an order from the Kenyan court. That was there was a little bit of kind of confusion there. Trump said there was no need to bring them to America if they were exposed. They could isolate, outside of America. I know Americans are pretty happy about that, but some people were like, well, no, they need to be able to come home and get treatment here. But being treated in facilities in Frankfurt, Germany, they do have the abilities. We have our isolation center, a main one in Nebraska, which has done very, very well. But if they don't need to travel, that far, and and they could be, closer to where they, were originally stationed. As long as they get proper treatment, they're going to be isolating anyway. So they might as well isolate, as soon as possible. Congolese authorities declared a fresh Ebola outbreak on May 15th. As you know, this has been smoldering for decades. Every year there's about 200-300 cases. But we had the big ones back in 2014 to 2016, and then this one. But this outbreak is caused by a different strain, the Bundibugyo virus. We don't really have vaccines or treatment. They've been working on it, and there has been clinical trials, but we're still way behind the curve on this one. People say, "Gosh, this is there's critics of Trump, and the lack of funding the U.S. has been. The U.S. is still giving the World Health Organization. The U.S. is still providing millions upon millions of dollars to global efforts. What Trump has wanted is that more people pay their share. Why does the U.S. always have to give the most? Why can't the U.S. match what the other countries are doing? Well, or not even. Or why do they have to pay 3 times or 4 times as much? But we are still don't misconstrue that we are still putting millions upon millions of dollars into these efforts. But what complicates the matters in a place like the Democratic Republic of Congo is individuals who were sick. People hide being sick. That's kind of what happened with COVID originally too. When the government was like, well, you can't work and we need to know who your contacts are and they can't work, that scared a lot of people. I heard people talking, saying, I'm not going to tell anybody. I'm going to stay home, or I'll say it's a cold, or I'll say it's whatever, so I don't have to quarantine or isolate. Quarantine is when we're questioning that you might be exposed. Isolating is now you do have it. So I means isolating, I have it. Quarantine means we're questioning. That's how you remember the two. So we quarantine when we think you've been exposed. This would be contacts. Isolation are the ones who have it, and we're isolating them. And so people with COVID were hiding it. They're like, well, I want to still go to the game, or I still want to go to, and that's sadly why legislators and public officials decide to take advantage of the situation and just lock everything down. And they say, well, this is going to stop people from spreading it because they won't be able to go to the concert. They won't be able to go to the Olympics. They could still go and vote. We're not going to move the election or change the election, but we're going to stop everything else. And that's what ended up happening. The other things complicating matters in the Congo is you have these militias or these militant groups that are attacking the health centers. Now, I know people are thinking to themselves, why would anybody attack? Don't they want to attack their enemies? Why would they attack doctors and nurses? Because they're sick. They're messed up in the head. Look at what happened in Iran, where doctors and nurses were raped, tortured, killed. If during a protest, somebody got hurt and was wheeled in to their ER and they took care of them. That's what happens when you have disgusting, sick people in some control. And so it's, you have, if you are living in that area and you don't want to go to a center that's going to get attacked and you don't want your family isolated, and you don't trust modern medicine, then they're going to stay quiet and unfortunately get to the point where the family is taking care of them, and then the family gets it, and so they have to, the government has to actually go out and find them. It's a scary time, but that's what's causing a lot of the issues where people aren't trusting American. Plus, there isn't a treatment. There's not and people are worried that once you are identified, because word spreads fast, you are identified as somebody with Ebola, nobody's going to want to be around you. Very interestingly, Ebola can hide in the body. And remember, there was a doctor in the first major outbreak that we had a decade ago, where the virus came back a year later in his eye. So when people feel, here we are in America, and we're a lot more relaxed as it pertains to infectious disease and HIV and things like that. But in other countries, if they think you have Ebola, they're not going to want to be around you ever. And that hurts your commerce. That hurts your ability to feed your family. So many of these individuals are like, I don't want anybody to know. even if it means I'm going to die, because then the rest of you are going to not be able to work or do what you need to do. It's a whole different type of thinking. They don't, very easily have the ability, well, just work from home and you'll be able to, live a life in solitude. No, not like in America. No. So that's, obviously pretty frightening. So, hopefully they'll be able to get a grip on this. The doctor, I really, really commend these doctors and nurses and medical students that are going over, to other countries to help. I think it's something that every student should do. Everybody should have that experience of being out of America and seeing what else is out there. That's why you also don't see a lot of doctors hate on America. You don't see a lot of nurses and doctors because they come back to America going, oh my gosh. Oh, thank God for America. Things are so much better and safer here. I think it's an experience everybody should have, but it's expensive, and medical schools are already charging students so much, to charge them more for that trip. But the work that these people do and put their lives at risk is just so heroic. 1-877 Dolly.
Carl Amari here to tell you about our newest website for old-time radio lovers. It's 100radioshows.com. At this site, there are 5 old-time radio shows waiting for you to download free as our gift to you, and be sure to browse the additional 700 old-time radio shows available to you for 70% off by using the promo code RADIO at checkout. This is a limited-time offer, so log on to 100radioshows.com. That's 100radioshows.com.
Have you ever thought you'd like to buy and sell houses but didn't know how or where to get the money? My name is Ron LeGrand, and over the past 40 years, I've bought over 3,000 houses without using my money or credit, and taught thousands to do the same. Today, even in a virtual environment, we buy nice houses in nice neighborhoods using no banks, realtors, contractors, or other costly entanglements, and build huge cash flow and wealth without the hassle of tenants, all without credit and little or no money. You don't need a license or experience, and I'll show you exactly how it's done. Text FREE to 99799, and I'll send you my free training. I promise you I'll change the way you think about real estate and open the door to a new lifestyle that doesn't involve risk or rehabs and can quickly replace your current income. Text FREE to 99799 and let me show you how to take your life back and build cash flow and wealth from your home. That's FREE to 99799. Again, FREE to 99799.
As an organ donor, your story doesn't have to end. The good in you can live on. In fact, you could save up to 8 lives and restore sight and health for many more. Sign up right now online as an organ, eye, and tissue donor. You'll be happy you did. And just maybe, someone else will be happy too. Go to organdonor.gov. It saves lives. U.S. Department of Health and Human Services, Health Resources and Services Administration.
And we are back on the Dr. Daliah Show, 1-877 Dr. Dali, 1-877 DOCDALI. So for years, they were saying that we were going to be running out of Medicare and Social Security money by the year 2033. They bumped it up. Now 2032. So in 8 years, Medicare and Social Security go broke. Now, people have not been panicking about that because they believe that the U.S. will just come up with more money. Either print the money or, but this go broke date is making me a little nervous. Originally, remember, they said it was 2036. Then it got pushed to 2033. Now we're hearing it's 2032. I'm already seeing cracks in the system because patients with Medicare are like, Medicare's not covering this, Medicare's not covering that. Now I got to come out of pocket. Medicare's not paying for this and this, and you're like, okay, well then, what are they paying for? And they're paying for hospitalization. They're paying for doctor visits, but being that the average patient isn't getting access to the doctor, that's kind of solving that problem where, they're using telemedicine and to save money. And it's still not saving the amount of money we needed to save. We're being told that with Social Security's trust funds, after it hits that 2032 mark, Social Security may only be able to pay 81% of the benefits. So there may still be money, but they're going to have to split. Again, this is what happens with more socialized programs. We start to run out of money. And I guess there's some news going around where the White House admitted that the federal government cannot afford to keep funding Medicare and Medicaid. Apparently, there was a luncheon around Easter, and a video had circulated where President Trump admitted out loud, which wasn't a lie, that the federal government cannot afford Medicare and Medicaid. Apparently, in this video, allegedly, he said Medicaid, Medicare, all these individual things, you can't do it. And so he said, we're a big country. We have 50 states. We have all these other people. We're fighting wars. We can't take care of daycare. That was about extending child daycare into the nation's two largest health insurance programs, where Medicare and Medicaid also pay for daycare. And he said that the daycare costs shouldn't fall to individual states, or he said that the daycare costs should go to the states. The federal government can't do it. He said, you've got to tell a state to take care of daycare, and they should pay for it too. And I see where he's going with this, because people can demand and demand and demand, but if the federal government runs out of money, then the state has a little bit more control. If they want to raise taxes, the state has more control over what their people want. So if Nevadans really want taxes going to daycare, taxes going to, then they could vote for that. There's a little bit more control. But from an across the board, do Iowans want to pay for New York City free daycare? That's thousands. They don't. Do their taxes go up for other states that have higher populations? So I agree that, if they are starting to look at free daycare, that would have to be more on a state or more local level. But we keep seeing time and time again that socialism and promising that we're going to take care of you and you don't have to worry about a thing is not necessarily working to the degree it needs to. I do agree that we do need Social Security and we do need Medicare, especially since we've had it now for decades and people are expecting it and we don't have another system in place. So we have to do what we have. But is there a better way to do this? I could complain. People can complain as the day is long. What solutions do we have? Do we have a way to fix this? Well, I have a relative, and all she gets is $1,200 a month from Medicare. I'm sorry, from Social Security. That doesn't cover jack diddly squat. And so they're getting money, but it's not solving the problem. If it solved the problem, then you'd have people maybe shut it up a little bit. But if even that, $1,200 a month is a lot of money that the government's paying, and it still doesn't cut what needs to be done. So do we need to have more senior housing that's cheaper? Do we have to, do we expand grade school and high school? Do we expand what we're doing with school? I told you how I think school should be. Where the kids are in school, the hardcore classes are in the mornings, the core classes, and then the afternoons are all learning life skills. High school ends at the end of sophomore year, because by then they'll have gotten exposed to all the trades, all the different types of jobs out there, and then for their junior and senior year, that's still technically under the public school funding, they get their associate's degree or their trade certificate. So by the time they are technically senior year, 18 years old, they'll already have a degree or a trade certificate. I think that's a better use of our money. Not to mention, you are going to have people in marketing or medicine or whatever want to help with those rotations that they do in the afternoons, farming. I mean, they learn everything. They learn, so then they have a better idea of what they want to go into, as opposed to just sitting and being on their phones in class. But what is the answer? If we are now seeing this rise of socialism, at the same time, we're hearing from the government, we just don't have the money. Now, people are saying, well, wait a second, Trump's full of crap because he needs money for the wars. A lot of our money that go to the government is supposed to be for infrastructure and protection. And then also to make sure that those in the most need have help. But we've changed the way we're doing things. 1 in 2 people, 50% of the country, is either not paying taxes or getting some sort of government money. Yes, the ship's going to sink. It's the system works, especially a socialized system could work if the majority of the people are actually putting money into the system. But if they're not, this is why healthcare has been such a mess. It was, we're going to make sure that even healthy people buy the insurance, and we're going to mandate that people buy health insurance. It's a crappy plan. It was just a cluster. So what we maybe need to do is work on early retirement accounts. Maybe we need to take some of this money that we're giving to health insurance for Obamacare and give it to people for health savings accounts. Maybe we need to work on how to do cheaper cancer treatments. And if you notice, Trump's already doing that. He's getting medical prices down. He's getting hospitals to be more transparent. Bipartisan credit for this, by the way, for in terms of the hospital transparency pricing. But, although Texas is so transparent, they're letting some hospitals in Texas are letting Mexico civilians know, you can have your baby here in Texas. Okay, that's a little too transparent. All right, this is, yeah. And so they're now under investigation for birthright tourism. But we probably need to go back and go, look, the reason why the system was supposed to work is all of us working and putting money into Medicare and Social Security was supposed to basically have our name on that fund. So that I've been working since I've been a kid. I've been working, putting money into the system. So if I've been putting money in, there should be plenty of money for me with all those tax dollars to then cover me. But the problem we have is money mismanagement. That system could have technically worked. I'm not a big LBJ fan. But if it had been done right, of course that money would have grown, would have increased interest, and whatever fund that would have done, then I should be fine. I mean, I have been working since I've been, 18. But you also have a lot of people that come here new that have not been putting money into the system. So we're going to have to come up with some better ways to fix this. 1-877-DOC-DOLLY.
Can you believe, with all the recent violent protests, looting, and destruction, some areas are considering either defunding or abolishing the police? At a time when America's neighborhoods need the protection of police the most, some elected officials would rather create more chaos by playing politics. If you're sick of elected officials caving in to demands of the radical left, you're not alone. It's time we stand up and declare our support for local police. The majority of police officers are important partners in protecting our God-given rights. If you prefer freedom over chaos, then learn how you can help protect the local police that serve your community. Call today and request your free Support Your Local Police info packet. Dial 800-JBS-USA1. That's 800-JBS-USA1. Request your free Support Your Local Police info packet by calling 800-JBS-USA1 today.